Myasthenia gravis. Okay, so that's our autoantibodies destroying the postsynaptic nicotinic acetylcholine receptor. So that means there are fewer available receptors at the neuromuscular junction. Okay, why does this matter? Well, vecuronium and other agents can be non-depolarizing neuromuscular blockers, and they're competitive antagonists of those receptors. So, fewer receptors. What does that mean? Smaller dose to outcompete acetylcholine and cause paralysis. Atropine, that blocks muscarinic, not your nicotinic. So atropine does not have any effect in myasthenia gravis. Isoflurane, inhaled, acting on CNS, does not depend on neuromuscular junction. Midazolam, that's a benzo, so GABA A receptor agonism, works centrally, not at the junctions. Acetylcholinesterase inhibitors, yes, these are used to increase acetylcholine in myasthenia gravis. But we're asking about our increased potency. And so acetylcholinesterase inhibitors decrease the effectiveness of myasthenia gravis because there are fewer receptors to respond to. So even more acetylcholine doesn't actually help because you don't have a lot of receptors. Vecuronium is going to be competitive antagonism at these receptors. And so you have fewer receptors, so more of the drug per dose, increased potency. Just give them a tiny little bit, they'll be paralyzed. So, test taking strategy, when the question gives you neuromuscular junction dysfunction like myasthenia gravis, ask, is the drug acting on nicotinic receptors? If yes, myasthenia gravis alters sensitivity to it because you have less receptors. Agonists like cystinocholine may need way more. Antagonists need less, right? Because you don't have as many receptors. So if you don't have as many receptors, you need more cystinocholine. If you don't have as many receptors, you're trying to block it, you don't need as much to block it. If the drug acts on the CNS, muscarinic, and GABA, then the myasthenia gravis has no effect on it. Because why? CNS, muscarinic, and GABA are not neuromuscular junctions. Okay, hopefully that was helpful. If you like this stuff, like and subscribe. More questions every single day.